Hello, my wonderful, beautiful friends. Guys, welcome back to r/entitled people, where people seem to think the world revolves around them and nobody else matters. Guys, if you've been wondering where I've been, holy moly, I got hit with the worst case of strep throat ever in my life. Like chills, fever, couldn't talk or eat for like a week. It was absolutely horrible. But now I'm back, and in today's episode, it's all about Karens running wild in hospitals because why not? It only seems fitting, right? I hope you guys enjoy the stories today. Don't shake your heads too hard. And as always, you can send or link your post to this email right here. Let's dive in. So a few days ago, I woke up feeling like trash and nauseous due to some health problems I've been having flaring up. One of the symptoms being vertigo, which causes me to be extremely nauseous. I called my family doctor, and she told me it would be best to come in right away and get some blood work done. So off to the doctor's office I went. I was waiting to see the doctor to get the exams done while trying not to die. Like literally, I was sitting in a corner, shivering, and I wanted to vomit really bad, as the vertigo is basically me feeling motion sick the whole time. But somehow I was holding everything down. And then enters the wild Karen, the entitled mother of the story. Now, the fun part is, despite having encountered many Karens in the past, this was the first time I've seen someone full Karen mode. The haircut, the gray yoga pant leggings, the furry white sweater, expensive handbag, the works. The woman basically burst through the door with her small daughter like she owned the place. At this point, it's also worth pointing out that the waiting room is basically full of sick patients waiting to be seen by the doctors working the clinic. The woman marches up to the desk and I can hear her say, "You have to let us see the doctor right now. My daughter is very sick. She's basically dying. She can't breathe." Now, this is a relatively small waiting room, so everyone basically can hear the Karen talking to desk girl. I then turn to the direction of the shouting and I watch this unfold. The front desk girl says, "Ma'am, I told you over the phone when you called. There's a wait right now for walk-ins. The only available spot today to see your family doctor if you want to make an appointment is 4 p.m. If someone cancels, I'll inform you right away." It was around 10 a.m. at this point. That's when Karen starts screaming at desk girl and says, "How can you treat patients this way? Don't you see my poor girl is coughing her lungs out?" I can then see the mom turning to the girl, who's basically prancing around the waiting area practicing ballet spins, and telling her to force a cough. Now, mind you, this poor girl didn't look to be older than 5 or 6 years old, and she didn't look in pain at all or even close to deathly ill. Like I said, she was prancing around, saying hello to everyone that would listen. So after some more arguing, it seemed like Karen had finally accepted that she wasn't going to be seen right away. That's when the little girl comes over to where I was sitting, and after introducing herself, she was asking my name, what happened to me, and pretty much in her words, she told me that she'd been coughing for a while, so her mom brought her in to get some meds. We were talking for not even like 5 minutes when the nurse calls me. So I say bye to the girl, but when I was about to follow the nurse, Karen comes almost running towards me, and she says to me, "Can you give us your spot, please? My poor girl is really sick, and she needs to be seen right now." Now, to be honest, if the girl looked to be in pain, or if she was actually dying, I'm sure the nurses would let her see the doctor before anyone else. But the girl simply looked happy to be talking to people. So I say to Karen, "I'm sorry, I've been waiting here a long time. I'm not feeling well, I'm nauseous, and I have to get blood work done, and..." That's when Karen interrupts me and she proceeds to grab my shoulder and start shaking me. She then yells in my face, "We need to see the doctor. You're fine. You're an adult. My girl is a baby." Now, let me tell you, if someone tells you that they're feeling nauseous, please do not touch them, let alone shake them. For a couple of seconds, everything just went blurry due to my vertigo spell, and the next thing I know, I emptied my stomach all over the floor, splashing all over Karen's legs and feet. It was a lovely combination of oats, apples, and whatever else I had for breakfast. Of course, with that happening, Karen screams at me and says, "What the F did you do that for? Why would you throw up on me? Now you have to pay for my clothes." The nurse just turns to me and says, "Ma'am, are you okay? Would you like to sit down?" I was still feeling weak and dizzy, but I could make out more screaming. The nurse just took my arm and she walked me into the room to see the doctor. When I got out, like half an hour later, the front desk girl told me that security guy had to come and take Karen away because she said she was waiting for me to, quote, get back at that dumb bitch for destroying her property. She then started cursing at the staff members because she said she deserved free medical treatments for life now. In the end, I just called my best friend to give me a ride back home. All I can say about this is do not shake nauseous people unless you want to get vomit on yourself. Oh boy, like that should have been common sense, right? And Karen learned the lesson the hard way, didn't she? Like why? Why would you even put your hands on anyone, especially somebody in a doctor's office who's telling you how sick they feel and that they're super nauseous? Like honestly, what did she think was gonna happen? Like, yeah, let's just shake the crap out of a complete stranger. That'll guarantee they give up their spot for me. But hey, that's some people for you, right? Like some people truly think it's me. Like why are you important when my daughter's sick? Why should I waste my time waiting when I can bully you for your spot? And guys, I've said this before, like there's never a need to stop to entertain these people. Like as soon as Karen marched up to OP and started talking to her, asking for her spot, the correct thing for OP to have done at that time would have been to keep on walking. But yeah, if you think that was entitled, this person shares their comment that says, "It reminds me when I worked the front desk at a dental clinic. This crazy entitled bitch demanded I call up 3 patients, cancel their appointments, and book her at her preferred time. All because she can't stand the traffic when driving from downtown Vancouver back to White Rock. Mind you, she refused the early morning appointment times because the traffic and, quote, it's too early in the morning. Are you crazy?" And the woman didn't like the other days. Her name wasn't Karen, but it was Carol, and I hated her. Okay, so this is gonna be a long one, but it's full of entitlement. I was in the hospital, and I ended up being put in the observation unit because no specialist beds were available. The observation unit is where patients are put if they're not in imminent danger but they need regular monitoring. It's bright and extremely noisy, so nobody can sleep well. Unfortunately, Biscuit Karen arrives at 10 p.m. on day number 1. Now, why is she called Biscuit Karen? It's because she wants a biscuit, and she's shouting this loudly enough for the whole observation unit to hear. Never mind, at that time, we're mostly trying to sleep. Never mind that her blood sugar is 8.5, which is elevated, and she's a diabetic, so she really doesn't need more sugar. But the long-suffering nurses do find her a biscuit, and they ask her to be quiet. But Biscuit Karen does not quiet down, because shouting is her default setting, and she doesn't seem to notice that other patients exist. So after 10 minutes of solid noise pollution, she wants another biscuit, and the nurses give it to her, and then comes more noise. Another 15 minutes later, she shouts for another biscuit. This time, the nurses are occupied, so nobody answers her immediately, so she shouts her request even louder as if we all hadn't heard her already. And this is where the nurses begin to lose patience. She's told to be quiet, and her blood sugar levels mentioned. However, Biscuit Karen insists, so she's given another effing biscuit. Now, maybe the nurses drugged this one because Biscuit Karen soon goes to sleep, and she snores loudly. Now, this was a taste of what was to come, but nobody on the observation unit knew it yet. On day number 2, Biscuit Karen's been okay all day, and nothing much appears to be wrong with her. She has a walking aid, and she can get herself to the toilet, but she doesn't want to. She then calls a nurse to put her on the toilet. That's when a very blunt nurse points out that she's seen Karen walking, so she's not gonna help her, and the toilet is only 10 meters away. But Biscuit Karen does not accept this. She keeps shouting for a nurse to help her. She keeps shouting that as long as she's here, that means she's a patient, and all nurses will obey her, or she'll have them all fired. Eventually, the blunt nurse goes to check, and Biscuit Karen has actually wet herself in a passive-aggressive rage. Biscuit Karen is screaming that the nurses are useless, and this is what they get for not assisting her. The nurse is shocked, and she's telling Biscuit Karen off, but Biscuit Karen does not care. Meanwhile, the bed's now sodden and the sheets have to be changed. The blunt nurse helps put Biscuit Karen on the commode, and then goes to get the spare sheets. Unfortunately for the nurses, the other patients are being equally tricky. There's an alcoholic man who can't walk, but he keeps trying and falling to the floor, and a woman with a broken neck who constantly takes off her nightgown and tries to go wandering. All the nurses are kept busy rounding up the strays, and they forget about the abandoned Biscuit Karen left sitting on the commode. Biscuit Karen ensures that she's not neglected for long. She then starts shrieking at the top of her lungs, "Can somebody help me? Can't one of you stupid nurses do anything right?" Her cries ricochet repeatedly around the observation unit, to the dismay of all the people trying to sleep. Eventually, it becomes, "Somebody help me, my back hurts." Of all the disruptive behavior happening on this unit, she's by far the loudest, the most persistent, and the most obnoxious, because she's caused her own discomfort in the first place. I'm now peeved, and so is everyone else. The blunt nurse gets back to her, and that's when an argument starts. The nurse is obviously mad as she's needlessly making the bed, and Biscuit Karen's angry that she's been left in an uncomfortable sitting position. In fact, she's getting even more aggressive by the second, and she eventually slaps the nurse across the face. Blunt Nurse doesn't put up with this nonsense. She abandons helping Biscuit Karen, and she leaves Biscuit Karen on a timeout, still on the commode, and she ignores all shouted demands to come back. She tells the other irate patients that she's not risking further aggression, and we all agree with her in solidarity. The blunt nurse was true to her word, so eventually, deeply compassionate nurse tried her luck, making the bed. Unfortunately for the compassionate nurse, Biscuit Karen is also a raging racist, and she not only calls her the N-word, but tells her to go back to where she came from. Of course, the compassionate nurse nopes out at that point, while blunt nurse calls security. Biscuit Karen has begun yelling every few seconds, "I want my phone, where's my phone?" Still from the commode, presumably so she can enact her threats. She keeps screaming, "I'm gonna report you all, I'm gonna get you fired." The nurses aren't stupid though, so nobody gives Biscuit Karen her phone. It doesn't occur to Biscuit Karen to get off the commode to find her own phone. Meanwhile, the other patients have hit their BS saturation point, and they've all started yelling at Biscuit Karen to shut up. It's past midnight at this point, and nobody can go to sleep yet. At this point, the cries from Biscuit Karen suddenly change to "Somebody help me" every 3 seconds, over and over again. The nurses are unmoved. There's a bunch of patients screaming at her at this point to shut up, but Biscuit Karen does not seem to hear them. In fact, she's completely devolved into a pathetic toddler tantrum, except toddlers have more self-respect, and she stays immersed in her self-pity for a long time. Meanwhile, 1 o'clock in the morning rolls around. Security officers take their time to arrive, but when they do, they're met with what appears to be a distressed old lady who claims that the nurses are hurting her and that compassionate nurse actually hit her. That's why she deserved to be called the N-word, which is an audacious lie. However, Biscuit Karen's way too dysregulated to keep up the facade for long, and she morphs back into a spiteful, racist, aggressive harpy when a nurse goes back to fix the bed. The security officers see exactly why they were called, and they try to keep the peace while the bed was finally finished. There's not much 2 thick-set men can do with a small old woman perched on the commode, but they tried. Eventually, Biscuit Karen starts demanding her medication, and somebody comes up with the bright idea of calling an accident and emergency doctor. And who can quell the entitled savagery of an enraged Karen? Of course, it would be a young, handsome, confident male doctor, the very epitome of a rescuer to an old bitch who's trying to play victim. When he turns up, Biscuit Karen becomes a sweet and compliant old lady, answering yes doctor, no doctor to all of his questions. She does try to repeat her lie about being assaulted, but several patient statements, 2 jaded nurses, and 2 exiting security personnel proved otherwise. The doctor gave Biscuit Karen her medication, and she was helped to bed and she fell asleep. Meanwhile, the rest of the patients on the unit were way too high on adrenaline to feel drowsy, so we were condemned to further wakefulness. I was glad to leave the next day. So if you read this far, thank you. I hope you enjoyed this sorry tale. And what a tale that was, guys. Like, Biscuit Karen sounded like a complete nightmare to deal with. And I just want to say props to nurses for putting up with patients like that. Like, I'm positive that's such a common occurrence in hospitals, dealing with Karens. Like, it must be so hard to keep doing your job and to care for a patient that's rude, racist, and aggressive like that. And this person shares their comment and they say, "I worked on a floor in the 80s before Karens were invented. We had this old lady who couldn't eat. as she had surgery the next day and she kept whining about it constantly. After midnight, her nurse microwaved some popcorn, opened the bag, and waved it around in front of her door. It was good times. So this happened a few years ago. On this particular day, it was my youngest daughter who made a trip to the hospital. She had woken up that morning with a mild fever and she was kind of lethargic and spent most of the day laying on the couch sleeping. Her fever kept rising and by 3 p.m. it was 103 degrees Fahrenheit. I called the pediatrician who told us if it got higher than 104, take her to the emergency room. By 5 or 6 o'clock, we were packing up to the hospital. My daughter wasn't very responsive and her fever had reached 105 Fahrenheit, which is 40.5 degrees Celsius. So we went to the ER. We get to triage and the nurses are obsessively apologetic because there's no beds in the ER. My daughter's fever's high, so they lay her across chairs in the waiting room and they bring out ice packs to try cooling her down. At some point in the middle of this, Karen and her daughter walk in and they sit across from us. Karen says, "Poor dear, what's wrong with her?" I tell her, "High fever." Karen says, "Oh, my daughter has a broken leg." Now, I wasn't completely lost in my concern to realize one thing. Her daughter was sitting cross-legged on the chair. Some broken leg, right? I say, well, it looks like it's gonna be a wait for everyone today. That's when the triage nurse comes out again and takes my kid's temperature. Karen says, "Excuse me." The nurse says, "Yes, ma'am." Karen tells her, "My daughter needs attention." The nurse tells her, "Ma'am, I told you before that our beds are full and we go in order of severity." That's when Karen says to her, "Well, you haven't even come to check on my daughter since we've been here. That girl," pointing to my daughter, "doesn't need any help. My baby is in so much pain. Look at her." The nurse tells Karen, "We have policies. If you don't like them, you're welcome to go to another hospital." At this, the nurse leaves and Karen is seething. Karen then looks at me and says, "I don't see why your daughter is getting so much attention." I just shrug and ignore her. Karen then says to me, "I asked you a question." At that, I give her a snarky response and say, "Oh, I'm so sorry. I'm just distracted by my kid's brain literally cooking in her head, you dimwit." At that, Karen says, "What did you call me?" I say, "A dimwit. Now shut up." At that, Karen goes red and she stood up to loom over me. I just smile at her and I say, "Do you have a problem?" Karen says, "I should call security on you." To which I say, "Sure, go ahead." And with that, Karen walks over to the nurses' station complaining loudly. The nurses were having none of it though, and they called security. While waiting, and her thinking she's been vindicated, I'm sure, a resident comes out. Now, this guy knew us pretty well, having treated my oldest daughter during several of our previous visits to the hospital. He and I speak briefly, and he tells me they're clearing a place for my daughter now. That's when Karen overhears and says, "My daughter needs to be seen first." Resident says, "Excuse me?" Karen says, "She clearly has a broken leg." Now I want to note, the kid's still sitting cross-legged on the chair and she's hiding her face behind an iPad. The resident doctor says she doesn't appear to be in any pain. This child is running a dangerously high fever. In order of severity, your daughter doesn't even rank on the list. Now you need to wait your turn or you can feel free to leave. Hearing him say that, Karen loses it and she swings a punch at the resident, which was the biggest mistake ever. Needless to say, security subdues her and they took her to the floor. I'm not sure what happened next, but the resident did press charges against her. My daughter ended up having a severe summer flu. After a round of saline and an ice bath, her temperature finally began to drop. Guys, some people are frickin' wild. Like, congrats, Karen. Now your daughter won't be seen by any doctor in that hospital, and you've got charges on top of that. Like, I'll never understand why people don't think before they act. Like, how did she expect things to go after punching the doctor? Like, was a punch supposed to somehow make the doctor go, "Oh, you know what, you're right. We will now see your daughter, ma'am." With that said though, that sounded like a wicked high fever, and I'm glad OP's daughter ended up fine in the end. So I worked in the emergency room for 6 years, so I'm full of stories. But this one sticks out in my memory. Every person who's worked in the ER knows that Mondays are the busiest days of the week, and that's also when all the crazies come out. And this day was no different. I worked as a nurse in triage. That's where you initially get assessed in the front before going to the back. Here, we determine who needs to go to the back first and who can wait. It's not a first come, first serve as most people think. We had a few stretchers in the front for people who needed to be monitored a little closer, or needed IVs, blood draws, labs, etc. There were 6 stretchers, but this day it was so busy that all 6 stretchers were filled, plus 5 more in the hallway. That's when this lady comes in on an ambulance, but because her symptoms didn't indicate an emergency, she was put in stretcher triage to wait her turn. She was in a lot of pain. After assessment, I recognized her symptoms as being caused from gallstones, which is painful but not life-threatening. So we put her on a stretcher, started an IV, drew labs, and hooked her up to a monitor just in case. A few minutes later, a woman, the patient's daughter, comes in the front door. One look at her and we knew she would cause problems. She had everything from the shoes to the haircut, a classic rich Karen. When she saw that her mom was still in the front and hadn't seen a doctor yet, she starts screaming that she knows the CEO of the hospital and that we would all be fired if we didn't get her mom back to see a doctor right now. We explained that her mom has a history of gallstones, and even her mother was saying that she's had this pain many times because of the gallstones. We explained about being really busy and that there's no rooms available, and we'll get her back as soon as we could. She eventually calmed down, but she was still antsy. About an hour later, another patient, who let's call the critical patient, comes in, and he was put in a stretcher beside the woman and her daughter. This patient had worrying complaints, but on initial assessment, we could not find anything wrong. Now, as a nurse, you learn to always trust your gut. When your gut sounds an alarm, you listen, and something about this patient was setting my alarm bells off. But all of his vitals were normal, and I had no solid evidence to declare an emergency. I just hooked him up to the monitor and kept a very close eye on him. I let the charge nurse know of my concerns, and she said to let her know as soon as something changes. Well, not 5 minutes later, something changed. Now, at this time, I should explain that this hospital was a level 1 trauma center, meaning we get all the bad cases, from car crashes to gunshot victims, stabbing victims, you name it. Since we had to be ready for any traumas, we had a room with 3 beds that was closed off from the rest of the beds, because traumas usually involved a lot of people and a lot of blood. Even on busy days like this, one of those rooms were empty unless there was a trauma patient. Now back to the critical patient. I was taking vital signs of the mom when I looked over to the critical patient. I noticed a worrying change in his rhythm, and that's when I stopped with the mom to start assessing the critical patient to see what was going on. And that did not sit well with her daughter. She actually grabs my arm and she starts pulling me and told me to finish with her mom. I just pulled my arm free and I said I had to make sure this critical patient was okay. As I turned around to him, his rhythm went to VFib, which is a life-threatening rhythm. So I called a charge nurse to inform her of his condition, all the while unhooking him from the monitor and throwing his bed into drive. As I start pushing him back, the patient's daughter actually jumps in front of the stretcher and stops it. She's screaming that her mom was here first and she needs to be seen before this guy. She was screaming that I was a liar and that she was going to get me fired. Now, I'm usually a mild-tempered person, but knowing that this critical patient was literally minutes from dying, I said to the patient's daughter, "You have one choice, get out of my way or get run over." I said that as I start pushing the stretcher forward. Now, another thing is, I'm really good at pushing stretchers fast and getting the patients to where they need to go in a hurry. Well, Karen tried to stay firm, but she saw I wasn't going to stop, and she jumps out of the way just as I was an inch from hitting her. Unfortunately, she didn't move fast enough, and I end up running over her foot. At this point, I don't care. I just got the patient back to the trauma room, leaving Karen screaming, just lying on the floor. We spent about 30 minutes on the critical patient, and he ends up dying. By the time I got back up front, the mom and her daughter had been taken to the back to see a doctor, but my charge nurse warned me that they were filing a complaint against me for assault. A few days later, the CEO of the hospital came to visit me on my next shift, and since this happened during a time before cameras were put into the ERs, he had to take what happened from word of mouth. Apparently, Karen said I assaulted her several times and put her mom's life in danger by not assessing her properly, and that I should be fired. It turns out that the mom did actually have gallstones and nothing else. Also, the daughter's foot was broken due to me running over it. I explained exactly what happened, and that her actions might have ended up causing the critical patient to die because of the delay she caused by her actions. The CEO then explained that the daughter was a friend of his sister and he knows what kind of person she is. And not only did I not get fired, he put a personal note in my file praising my actions. On my next review, I got a raise and a bonus, thanks to the CEO's note. Holy moly, the audacity of that Karen to press charges against OP makes me so freaking mad, guys. Like, how dare you? And OP's right, the critical patient might have died because that Karen was blocking OP from getting to where she needs to be. Because in those situations, seconds matter so much. And it's just so unfortunate a life was lost that day. And this person comments, it would totally violate HIPAA, but I would have gone and found her in her mom's room and explained to her that her actions probably cost him his life. And this person says, unfortunately, I would assume that for someone this entitled, she probably wouldn't even care. OP would just be wasting her breath. Which is so freaking true, right? Like, someone dying isn't affecting her, so why should she care? And again, we don't know if what Karen did caused the patient to lose his life, but damn lady, you can't just block nurses who are telling you to get the F out of the way. And that, my friends, brings us to another end of our /entitled people. Guys, I hope you enjoyed today's episode. If you did, hit that thumbs up, and if you're not subscribed, consider subscribing so you don't miss these crazy stories. And if you missed the last episode, which was over a week ago, guys, it's a malicious compliance and Karen bosses are getting absolutely destroyed. Go check it out if you haven't, and myself and Stevie Boy will see you guys in the next one. We love you.